From time to time, your elderly loved ones are going into the hospital. An elderly person may not be able to go home after hospital stay. What is the alternative? And we're going to talk about that today.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good afternoon, good morning, good evening, because I don't know where you all are today. And here is Andrea Albertini and Lucy Torres and Senior Care Made Simple podcast.
Good morning, afternoon, good evening. Wherever you are, whenever you're listening, we're here.
Exactly. And today we have an amazing guest, and her name is Pamela Fuess, and she is the administrator for Ventura Health and Rehab Center. We're going to go starting today, talk about advocacy, right? Our healthcare system is constantly changing every single day. And if you are not up to date what's going on, and if you don't have any support system for your elderly mom or grandmom or your grandfather or your your father, we are here to talk about advocacy. Your mom or your dad goes into the hospital, you have no idea about what's available, what's next, and they may not be able to go home. What is the alternative plan after the hospitalization? Because when they're in a hospital, they are in an acute setting, right, Lucy?
Yes.
They're in an acute setting. So sometimes they're there 3 days, 4 days, 5 days, 10 days, whatever the case may be. Or sometimes they're just there for surgery. Either you have a knee replacement, a hip replacement, or just a fall. Then now you're there for rehabilitation. So now you have choices. You may have to go inpatient to an inpatient rehabilitation center. And a lot of you all who are not in a healthcare industry probably don't know that nursing and rehab center, there's a difference. There's a nursing home that actually provides short-term rehab. So sometimes people go there for long-term care. So they have a whole section of the nursing and rehabilitation that is just for long-term care. And those are the very acute patients. And then we also have another side that is basically the short-term rehab. And we're going to get Pam in to talk about that in a little bit.
And what's great is when you mention advocacy for your loved one, for the elderly loved ones. Advocacy is a voice, having someone that is your voice and it gives you hope. And I'm sure, Pam, that you see a lot of that. So sometimes we want to self-advocate, but we don't have all the resources. We don't have the knowledge, just like the children don't. So talking about those resources and who's your voice during this, who's going to advocate for you.
Absolutely. Advocates are very important in all aspects of healthcare. And certainly after hospitalization and rehab stay, family support and your support helps them get well faster to get home.
And we know advocacy, Andrea, from all the years of working in our industry, and you running this company, and firsthand, you even going out there and advocating for patients in the hospital.
And then also, too, there is a rule and regulation from Medicare that you need to have a 3-day hospital stay.
3 midnights, yes.
For you to go into rehab. And to be able to go into the hospital and advocate for your loved one. It is very important to do that because it does get very confusing when a case manager is trying to, hey, you can go here, you can go there. The doctor will say, oh, you can go here, you can go there. And at the end of the day, what they're talking about is the relationships that they have with those salespeople, not really what the facility is about, right? And it is very important to know quality. What's quality? Where should you trust to send your loved ones to be able to rehab and rehab well? Right, Pam?
Absolutely. The case managers on your way out the door of the hospital pretty much will hand you a list. I had one gentleman come in the other day. The case manager gave him a list of 7 facilities to look at. And that's just a lot of time and confusion for the family. Mm-hmm. Our facility provides the cleanliness, the care, everything that you need for successful rehab. And Andrea, you've visited our facility many times. Our patient rate of going home is very high in the rehab facility, and it's clean. And there's a lot of things that we do that no one else does. We can talk about that too. But getting them in the door out of the hospital is the first important step.
Absolutely. And be able to know where they're going. And, and it happened in my business too. Case manager gives them a list. Well, they don't know. They have no idea. And they don't have time to check. So if you are a child of somebody elderly that is in this position in the hospital, you need an advocate. You need to look how many stars they have. You need to, get reference for those facilities. Or even if you're requesting private duty home care, there's going to be times that, that if your mom and dad are not in a hospital more than 3 days, they're not going to be able to qualify to go into a skilled nursing facility for 15, 20 days of intensive rehabilitation, which that's what your loved one needs, correct?
Yes, it's a great point you brought up, because also they have to be admitted inpatient, not under observation. That's another thing that people don't understand. They say, oh, I was admitted to the hospital. They don't realize they're still under observation. Well, that's not going to qualify them as 3 midnights inpatient. And that's a big deal, because that affects the fact that you didn't qualify for your 3 midnights because you weren't actually inpatient admission. You were under observation. And that affects the insurance and affects the care after discharge. So that's a big thing for people to understand.
Yeah, because Medicare will not pay the bill if you don't have a 3 midnight
That's
stay.
right.
You're going to pay the bill, and you don't want to get to a facility and find that out. This is why, too, if you come to a place like ours, we'll check the insurance for you. We'll check the availability. We'll check the your ability to come under a Medicare stay, and we'll give you all the information you'll need to make sure you're all set.
Yes, and patients don't know that. And when you go into the hospital as a patient, especially an elderly patient, you're more likely confused. You're in pain. You're emotional. You're scared, and you don't know the difference between I'm here under observation, because you think, just like the word says, observation. They're observing me to see what's going on, but they don't realize that under observation is not going to pay for them to go to rehab. So it's a big learning curve for many of the family members and for the patients themselves. And speaking of advocating, us continuing to advocate that anytime someone tells me, oh, my mom or dad, they're in the hospital and I want them to go to rehab, I say, are they inpatient? What do you mean? Yeah, they're inside the hospital. They are. And I said, no, that doesn't mean that. And then I have to explain to them, make sure you speak to case management immediately and find out if they're inpatient or observation.
Yeah. And when we get the referral from the hospital for a patient, we can tell on the computer system exactly when they admitted the patient inpatient. So we know, even if the case manager can't explain that to them, if they come to us on a tour or an inquiry, we can tell them if they've been inpatient or not.
That's great.
Yeah.
And the other things that I want to mention to the listeners, you can private pay. So if your mom and dad are in a facility, if they don't qualify for the 3-day hospital stay, you have the option to private pay if that's what you want to do. You know what I mean? But the other thing too is advocacy. When your mom and dad or your loved one goes into the hospital, we can also provide a sitter for them, right? So, if let's say you don't live around here, you don't live in Florida or whatever, you don't live in the same town that your loved one is, right? So then what happens is our caregiver can actually go into Ventura and stay, with your mom and dad, grandpop, grandmom, until they're ready to come home, right? And so there's other options. But, a lot of times people get discharged too soon and they're not sent to a rehabilitation center. So you as a child that has some elderly parents, it is very important for you to know what the status is of your mom or dad or grandmom, grandpa before they leave the hospital. Because, like I said, many times they end up back in a hospital again because the rehabilitation was not offered to them by nobody for whatever reason.
Yes, or the patient says, no, I just want to go home. And no one wants to take this, or they don't know who to contact. Or they think, okay, you say you don't, and they're not incompetent. But it's great if a child is visiting and you can kind of have that conversation with the patient and say, is it okay if I speak with you in front of your child about what our plans are for discharge? More like they say, yes, sure. And that's when the discharge plan or case manager say, so you have the option that you can go to rehab, which is what we feel is the safest discharge. But you did say you didn't want to, you want to go home. You're going to have the child 95% of the time interject and say, Mom, Dad, what do you mean you don't want to go to rehab? They just said it's safer. And that kind of helps, kind of to be a buffer to direct the patient, because you're right. Then you fall into readmission because they go home, they promise the case manager they will hire someone, and then they go home, they're home alone, and they feel like they have neighbors who live nearby that can help them. We've all heard that story. And then they end up having a fall because they're not ready to go home yet, or they didn't hire someone. Because if they went home, we could have someone prepare them in the hospital and bring them home.
Right. And then they have to go through the whole process all over again at the hospital, and they're in worse shape the second time around because they've had a fracture of the fall. So it does happen.
It does. And it definitely does help prevent readmission.
Yes.
Going directly to rehab, getting the services that you need. And then if you want to go home after that, great. You can still go home with private duty, have someone there to monitor you, and even come outpatient. Do you have outpatient,
yes, we have outpatient
there as well?
Mm-hmm.
Yeah,
yes, we
so
do.
that's fantastic because they like to keep that continuity. Once they build a relationship with that physical therapist, and they feel so comfortable and they feel safe and they trust them and they can actually come back.
That's a very good point. They can get the same therapist they've had inpatient, and they have that continuum of care. And our rehab gym is extensive with all the modern equipment and so forth. It's so much better than getting therapy at home where they just use some elastic straps or whatever.
Yeah.
This is high-tech therapy. So you're going to get the best quality therapy by coming back outpatient.
That's right. And for the children that say, well, how is my parent going to get back there once they're home? That's when Horizon, we can step in. We have our caregiver that will safely bring your parent back to your rehab center and then back home and stop at the grocery store, get them some groceries, any medications they need, and they're home safe. And you have this circle of care provided by all of us.
Oh, absolutely. Yeah. And it's all about teamwork and continuity of care. It is so important. And, we are having some challenges. And Pam, you and I talked about it last week when I was visiting your facility. We're having some challenges dealing with some of the skilled nursing facilities in Palm Beach County. Lately is that unfortunately a lot of people are buying out all those facilities and they're forgetting the level of care, that they used to provide. A lot of our communities now doesn't provide the level of care that they did before.
You're right, Andrew. The stability is one big factor in providing great care. And we have a stable staff. We have a stable company. All around us, the facilities are having problems. Like you say, they're being sold and resold, and the care has gone down quite a bit. And the cleanliness and all. We hear this from people that tour before they come to us.
Sure.
If they come to us, they'll always, the 99 chances out of 100, they will pick us. And they tell us what they see in these other facilities. It's really very disheartening, but that's what's out there. So you just got to be careful.
And you also have care plan meetings, correct? Where you include the family and the patient.
Yes, we do. And we have routine care plan meetings, but we also have care plan meetings if the family in general has multiple questions. We'll get together with our team and have a special care plan meeting so that we can talk to them individually with all of us present to make it more convenient for them, and they can get all the information at once. We'll do that anytime, and they can always call any one of us if they have questions about their loved one and their progress. They can go to the gym and observe their loved one getting therapy, talk to the nurses about the progress. We also have physicians and nurse practitioners that will call them if they have questions.
That is so helpful right there. That's all a form of advocacy in that circle of care that we continue to talk about. That's great.
And also the communication. This is part of advocacy, right? Because sometimes your loved one is just sitting there in a bed or just laying in bed. The food is on one side. They haven't eaten. The food's cold. That's what's happening in our health system today. So having an advocate to help you with your loved one is so important. So please, 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 no matter where you are, in any country, any state that you listen to this podcast is only information and resources for you all to understand the aging process and how to take care of your loved ones.
So Pam, question for you. If I was a patient or someone who has a loved one in the hospital and this case manager, discharge planner comes over, hands them a list of 7 different communities, facilities, rehabs, and it's so confusing. What are the 3 questions they should ask before they can even look at this list and make decisions? What are the 3 things to look for?
Okay, good question. First of all, when you walk into the building, there should be a generalized feeling of welcome. They should be friendly. Someone should assist you right away, and people are smiling. And number 2 is the cleanliness. I'm hearing a lot of times people step into the lobby of some of these places and they can have a very nasty smell. So our building is immaculate, but this is what people say when they tour our facilities. So when we walk around, that they get a tour of every place they want to go, that we're not hiding any place where they see the gym, they see and talk to other residents. When you stop in the hallway, you can talk to a resident and say, hey, how's the care here? How are you doing? And right from the horse's mouth, they're going to tell you, believe me, if it's good or bad. And
touch about the food.
The food, that's a good one too. And then you can ask about the food. We have a program where we have room service and we have dining room service. The other thing you want to check out before you check out anyone is the Google reviews.
Yes.
Now, before you even step in any of the buildings, because it's a lot of legwork, you can go on our website and anybody's website. Number 1, our website, you can see pictures of the facility and of us and all the comments that actual patients have written about us when they leave. And these are real reviews.
Testimonies, yeah.
Some of these places put kind of fake reviews in there, but these are all real. We ask our patients if they're happy to do a Google review, and most of them do. But so you can see that, and then just do a tour. If you come in and talk to us, we will spend time with you. A lot of other facilities will brush you off and make you wait in the lobby, have you fill out paperwork. We are on top of your inquiry when you come into the building. You don't need an appointment. You can come, I don't say 24/7, but you can come 7 days a week. There's always a manager there to give a tour. Come on the weekends. That's a real test, because the staffing in a lot of places is not the same, and you would see something different going on.
Yeah,
but
there should always be manager on duty.
Yes, we have a manager on duty. Yes. We have an RN supervisor. So we have plenty of supervised staff on the weekends, and our staffing, our nurse staffing, doesn't change from the weekend to the weekdays. It doesn't change.
So this is for you and Andrea, and I know the answer, but for Andrea to tell the audience. So, okay, I'm in the hospital bed, but I don't have a family member to go look at the community for me. And you mentioned Google reviews if they have the capability. But Andrea, you have elder care finders.
Right. So we have another division of Horizon Care Services called Elder Care Finders. So for Elder Care Finders is mostly the assisted living placement, but because we're a full service senior care, they can call us and say,
I was referred this list.
Right. I got this list. I don't know where to start. I don't even know where to go. So we do get those calls all the time, right? So I say, what area would you like to be? Tell me a little bit about what's going on with your mom or dad or grandmom, grandpop. And then I help them make a decision. And, Lucy, you and I are in and out of those facilities all
and we
week
know
long.
Them. We know
and
them.
we know who they are,
Yeah.
right? And we know how important it is choosing the right one for you to be able to rehabilitate yourself. So this is a free service that
we can
Horizon
be your eyes
provides.
and your ears when they give you that list. We can go out there and find that place for you.
Exactly. So this is a free service.
And one more thing I want to mention also, because you're searching for the place, it doesn't have to be always the closest one to home. A lot of people search out a facility because, it's only 2 minutes from my house. That may not be the best choice.
I agree 100%.
So you're going to provide them with the actual best place for their loved one.
And you may have to drive a little farther, but you know what? You know that you can sleep at night.
Yes.
You know you don't have to worry
I would rather
about
drive
it.
to your building because of the exceptional feedback, the care you're going to get. I will take my parent there because I want to know that he or she's in the best environment, best type of care.
And it's very important. Everything's so close, too. Our service area is so small, but whatever service area in your view are, look at the quality. It's like I always say, look at the stars that Horizon have. Look at our surveys. Look at how wonderful and amazing of care that we provide. And most of our employees have been here for a long time. And that's like Ventura as well. She has such a great stability with her staff there, from the MDS to the dietitian to the director of nursing, to the social worker. I mean, the social worker is awesome. She's amazing.
She is.
Haley's amazing.
Very
She's
important.
a sweetheart. And which is really important because that's who the family is contacting. But also, Pam, you are very hands-on it though, as an
That's true.
administrator.
That's true.
I know you for many, many years. You have been in other facilities before in the past, and you are very hands-on administrator. I mean, your office is right on the lobby, and you know everyone that comes in, and you greet everyone that comes in. And it's very important because it does starts from the top.
I've been doing this for about 30 years, and I will honestly tell you, I know all my patients, and I know most of the families. They are welcome to come into my office at any time, and they do.
Yes,
or they can
do.
call me. And some people, if they're having a particularly hard time, I even give them my cell phone number to access me 24/7 because I want to be accessible if they're having a problem. But most of my staff is accessible 24/7 as well.
That gives them peace
So
of
that's
mind.
yes, exactly. Yeah, you can always reach one of us. Yeah.
Which is
great.
wonderful.
Yes.
And for us who advocate for our seniors in our area, you and I also have all the cell phones for those administrators, those social
That's right.
workers, and everybody.
We are a
that
call
we
away.
work with.
Just
Yeah.
call us and we will help you and become that voice and that advocate for you and for your loved ones.
Pam, thank you so much for coming and sharing the information about your community with us. And all the information for Pam will be in our show notes. Please follow us on our next episode of Senior Care Made Simple. Have a great day, Pam, and have a great day, Lucy. Thanks, everybody, for coming today.
Thanks for having me.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.